As of 1 o'clock this afternoon, there are 986 cases of COVID-19 in Toronto. This includes 812 confirmed cases and 174 probable cases. There are 89 cases in hospital and 42 in intensive care units. Approximately 27% of our cases are attributed to community spread, and there have been 13 COVID-19 deaths in total thus far. Again, I extend my sincerest condolences to the friends and families of all individuals who have died from COVID-19 in our community. Earlier today, as you've just heard, the province released COVID-19 modeling projections that stated that there would have been approximately 100,000 deaths over the course of the COVID-19 outbreak without public health measures. The province also said that if we do everything that we can, fully implementing all available tools and public health measures, especially those that maximize physical distancing, we may reduce this number to something in the range of 3,000 to 15,000 deaths in Ontario from COVID-19. Now we know that Toronto is home to about 20% of the population of Ontario. So using the provincial numbers, we would roughly estimate that Toronto may see somewhere between 600 to 3,000 deaths by the end of this pandemic. I know these numbers are stark. Seeing what our future may look like based on these data is truly sobering and even frightening. But these are more than just numbers. They are our friends, our families, our neighbors, members of our community. They are our essential workers, our healthcare workers, and they are the people who work each and every day to help keep us safe. Most of all, these deaths are preventable. This is what keeps me up at night. We each have an opportunity and a personal responsibility to prevent this from happening. This is why everyone who can, everyone who is not an essential worker or a healthcare worker, needs to stay home now. Everyone needs to be adhering to the public health measures put in place to save lives, to protect our healthcare system from being overwhelmed, and to restore our city. If we all do our part, if we all do as much as we can still reduce these numbers. If we take care of our city's most vulnerable residents, we can lower virus spread. I sincerely hope the starkness and the clarity of the provincial numbers will be a wake-up call to all of us, particularly to anyone who does not yet understand the gravity of our situation. Models help us to predict how diseases might spread, and they help us to predict the future course of an outbreak. They also help to inform our strategies to control outbreaks, to protect our community from virus spread. However, they are only as good as the information and the assumptions on which they're based. And with a new virus, like the one that causes COVID-19, information changes every single day as we learn more about this virus and how it spreads. Our models need to be adjusted to reflect what we are seeing in our community. My team at Toronto Public Health has reviewed available models, and what they consistently show us is that with the absence of a vaccine or effective treatments for COVID-19, we need to use other strategies to reduce the spread of the virus and to ensure that our healthcare system is not overwhelmed. These strategies include the strict physical distancing measures that we have put in place, as well as enhanced case and contact tracing and the use of self-isolation. While we use models to inform our thinking on the kinds of interventions we can use to control virus spread, they also help us to inform our thinking on how long these interventions and measures may need to be in place. We know that it takes time for our interventions to have an effect, and unfortunately, this will not happen overnight. So what do these modeling projections mean for Toronto? Well, we use these mathematical models together with our own city data and the experiences and data from other jurisdictions. When we put them all together, they give us the best possible picture of what our future could look like, especially if we do not act now. For anyone who has been watching the news on COVID-19, you know that countries like Spain and Italy have case counts over 100,000 and high fatality rates. In the case of Italy, the death rate is estimated to be more than 12%. What happens next here in Toronto? Our story here depends entirely on your actions, on our collective actions. It is important to share the starkness of this information with you so that you can understand why we must all get behind the physical distancing measures we have put in place. Most people want to do the right thing. I really believe that. But there are still hot spots in Toronto where people seem to be putting their own needs, their individual needs, before the needs of our community. They are still moving around the city and not practicing physical distancing. And from my perspective, as your medical officer of health, I find this deeply troubling. I do hope that today's information, the numbers that were provided today, will help these people understand the gravity of our situation. This is why it is so important for as many of us as possible to stay home. This is the only way we will reduce virus transmission in our community so that we can protect our city, so that we can minimize the loss of life, so that we can manage pressures on our healthcare system, and so that we can get our city back as soon as we can. This message is for each and every person in Toronto. If you do not keep your distance from others, if you cannot get behind these measures, you are putting at risk all of the people you care for, all of the people that we care for. The sooner everyone complies with these measures, and the better we can all comply with these measures, the sooner we can make it through this challenge together. Please, stay home, stay safe, and take care of each other.